everyone, my name is Stephanie and my major is gynecology. Welcome to my channel, Gynecology with Steph. Today I'm going to be having breakfast with Dr. Matsi M from City Surgery Clinic, and we are going to be discussing the medical condition obstetric fistula. Stay tuned. Hi Matsi.
Hi Steph.
Good to see you.
It's good to see you too.
You look amazing.
Thank you. You look good too.
Thank you. So, how are you doing?
Well, I'm good. I'm just
Yeah, I
happy
can
to
see
be
that.
here.
Like, you know, from how you look, I could tell.
Thank you.
Yeah. Matsi,
Yes, Steph.
permit me to ask you a few questions.
Okay.
Yeah. Yeah, the first question is, could you please explain what obstetric fistula really is?
Wow. So, it's one of the most serious, injuries of childbirth. And what happens is that due to prolonged labor or obstructed labor, there's tissue damage, which leads to a hole being formed between the birth canal and other pelvic organs. That's basically what obstetric fistula is.
Yeah, that's right. Thank you so much, Matsi. This question is, who is at risk of obstetric fistula?
Oh wow. Okay. So this is actually very interesting because the risk factors are a lot. But let me just put this, the main risk factors are, we have the gender. Of course,
Right.
you have to be a woman
Yeah, that's
to
right.
have that. We have gender factor, we have age, we have, by age, I mean, adolescent pregnancy or girl child marriage and all that. And another factor is socioeconomic status. Because it is something that is not common in developed nations. You actually find it in places with low income.
That's
and
right.
everything. So there are three major things that you can build the risk factors around. We talk about accessibility, right? We talk about affordability and acceptability. Basically, these things will give you an idea of who people that are ready to accept medical health care are not at much risk. People that have accessible medical health care are not at much risk, and people that are actually taught about proper health care, what to do and all that, are not at much risk. So yeah,
That's right. How do you diagnose obstetric fistula in the clinic?
okay. So how in med school they tell you history is a great tool in diagnosis. Yes, this is the case again. History is very important. So from the age, I mean the gender should be there obviously, but from the age of the person, and then the obstetric history.
Okay.
Why is this person here? What is the chief complaint and all that. I think those are the major steps for diagnosis.
Okay.
Because most times people that have gone through prolonged or obstructed labor, if they are in a good medical system, they actually check them for that. But in cases where they are not, they normally come presenting with chief complaints of urinary incontinence,
Okay.
or fecal incontinence. So when somebody comes with that, or probably an infection, and if you're taking history, you find out that this person gave birth a few months ago, or a few weeks ago, or a few days ago, whatever. There are factors that you put into play. Then it leads to physical examination, where the doctor physically examines the patient, what's happening. And sometimes you can actually see that the urine is coming out from, the birth canal instead of the normal way it's supposed to. Or you could see, very sad, or you could see, the feces coming out from, the birth canal, which is really abnormal. And then the patient could be complaining of foul smelling discharge, and all those things. All those things are things you can build around and bring forth a diagnosis about, okay, this person has this person has that, and yeah.
Wow. Yeah, that's right. Thank you so much, Matsi. You're doing well.
Thank you so much for giving us an insight to what obstetric fistula is all about. So, have you had such cases before? Yeah, I've come across cases like that. Yeah, so could you please tell us what the experience is like? was a pleasant experience. It wasn't, because lives were involved and it was sad. Yeah. But one of an example is of a patient that I came across in my home country, and she was a 2-year-old girl who is married.
Wow.
Yeah.
Wow,
Who
guys.
is married, and she was pregnant and had an obstructed labor, but because they stay in a very rural area, she couldn't go to hospital, and they kept trying to maneuver, to just make sure that the baby is not breached and whatnot. At the end of the day, she lost the baby for the stillbirth, but then she had fistula. Now the challenge wasn't just that she had fistula. What brought her to the hospital was infection. So she presented and she was running temperature, high temperature, she was shivering, and after some tests we realized she had infection. But why did she have the infection? It was due to obstetric fistula. So she had, there are 3 types of obstetric fistula based on the anatomical location. So what she had was vesicovaginal obstetric fistula, which is very common. That's the one that leads to urinary incontinence. So urine was just coming out uncontrollably, and she didn't have relatives. She just came in herself, and for a 13-year-old, that's confusing. First of all, we're talking about psychological effects. We're talking about how her body is responding to the hormonal imbalance. I mean, she just had a baby.
First of all, I was just wondering, like, I'm thinking about this. She's 13, isn't that supposed to be patient for pediatrics? And then now she has to be in that position.
Well, so this is the thing. Obstetric fistula is not just a problem for patients. It's also a problem for the medical system, because now we have, since it's common in adolescent pregnancy, we have somebody that is sick that is supposed to be in pediatrics, but right now she's also is an obstetric condition. So just merging the two and finding a solution. I mean, should we about the mother those issues not, because with pediatrics you have to be mindful of those. So it's quite tricky. It's not something that is easy to handle per se, and she does not have the emotional maturity to handle something. How would be able to communicate effectively to this person so she will understand what is happening to her body, what is happening to her. So there are a lot of things. I think it's also a humanitarian issue. It really reflects on us as our human rights values. Yeah, it does, because you will. I don't know. I'm sorry, but I don't think it's right for a 13-year-old to be pregnant and to have to go through that. But hey, that's my stand. Of course, yeah.
That's my stand.
Yeah. So it was quite a confusing condition, especially for the patient, not just for the patient. As I said, it's a medical system crisis, it's a societal crisis, it's a health crisis to the patient. So she came in, she was dropped at the hospital, and she came in, but we didn't get so much from her. She didn't have the detailed medical history. She didn't go for antenatal. She didn't have who assisted you in childhood delivery. She didn't even understand a lot of things. So we had to work with the little we have. And when you're taking care of a patient, information is important. It's very important. So it was quite traumatizing.
What was the family support like for this patient?
Well,
Especially the
our family support is important, right? And one of the major programs that the UN and WHO are doing is educating the family of the patient concerning how to handle. Yeah, family support is very important. But in the case of this particular patient, she didn't have family support. She didn't have family support, and you said especially the case of the husband. I don't think I saw the husband at all. Yeah, and it was a polygamous setting, and she wasn't the first, she wasn't the second, she was the third wife. And the husband is not educated. She the case of literacy, you have the case of cultural barrier to the I can't say this is why you show exactly. I never told you. All I know is what was happening. And I think that's so important because even though anyone that's the part of your journey, is it the father of the baby, or let's say the partner, or whoever the person is, through the journey. Yeah. So this is something that she didn't do herself. It was self-inflicted. It's something that happened as a result of living a life to this point. And what person cannot just think like it takes two people to do that. So it was strange that it was over. And I think that should never be the conclusion of this situation. Like a husband, I feel like the husband should not go through a long way compared to any other person's response.
Right. Let's see. So, can you talk about treatment and management of So, a lot of people don't know this, but there's actually a treatment. It's surgical, it's not common, but there's a treatment, and it's reconstructive surgery. So, what is done is, the hole that was formed as a result of obstructive labor, prolonged labor is sealed. The challenge, however, is that we have few people in that field. We have few people that can do it.
And we also have the issue of accessibility to good medical health care. Because I mean, the people that are vulnerable to these conditions don't have accessible medical health care. So how can they access, such kind of treatment? And as I earlier said, it has to do with socio-economic status.
Okay, so it also has to do with socio-economic status, in the sense that can they afford such care, can they afford such treatment. So yeah, that's it for reconstructive surgery. Another thing is, but that reminds me, it's important to always treat the underlying, like treat other conditions that came as a result of obstetric fistula, like infection, for instance, get treatment, and after that, in most cases, people just look at it, to help and to bring back and send the person home. But these days we have the issue of reintegration. This person has just gone through trauma because of the whole stigma that comes with that. How do you prepare the person to enter the society? I mean, carrying a bag is cool, carrying a green bag is not. Yeah. So how do you prepare the person psychologically for that? That's part of management too. So we have counseling where you tell the person, you encourage the person. You also have family, to then explain to the family also what this patient has been through, like what kind of support they can give the patient, because it's really important to do that. At the end of the day, the patient is going back home to the family. Do they understand that they have to package up? And in a system where the healthcare system provides public health workers, to go home and check on the patient, it's really important to do that. And it's really a fact. And unfortunately, statistics show that by the year 2020, the number of obstetric fistula is going to go higher because of the influence of COVID-19. Yeah, because right now a lot of resources, medical resources, have been moved towards the prevention of COVID-19 and all that. So now we don't have free contraceptives the way we used to, right? The funds have been cut. So there will be a lot of crises in 2030. I'm sorry to say that, but statistically, there will be obstetric fistula crisis because it's a very preventable condition. It's a condition that should be prevented. Don't allow it to go to the level of how do we manage this. Prevention is better than cure. Thank you so much. Yeah,
Really, there's so much the general public should know about obstetric fistula. And one of the things I want them to know is it's something that is not self-inflicted. It happened to the person. It happened to the person, so they should be sympathetic. Because stigma is one reason why some people don't even seek for medical attention. They hide inside because they are ashamed of what people think of them and all that. So I think that the general public should what if of people that already have obstetric fistula, it didn't happen to them? You know, they should even be celebrated. I mean, they got it, bringing life to this world, you know. So yeah, the general public should support them, encourage them, and if they are in a place where they can provide, you know, service, and I will encourage every mother out there to protect her baby girl. Really, protect your baby girl with your life, because I mean, a child shouldn't have to go through this. Imagine an adult going through, like, can you even think about it? Now, a child that doesn't fully understand what is happening to her body going through this is just hard. Don't encourage it. Be against it. Protect your daughters. You know, protect their future, because it's not just about getting married. I mean, for instance, the case I was talking about, the man was nowhere to be found, and the girl was left vulnerable. So protect your daughters. Protect your daughters. Another advice I would give is for people to understand that we are intertwined in some way. So you may think it's not happening to you, you know, and feel, oh, okay, it's not something I have to deal with. But the truth is, it has economical, you know, it has economical implication. It has, it shows where we are with human rights, you know, like obstetric fistula is a socio-economic crisis, as I said earlier. So it's happening to us all, actually. It's happening to us all. And how does it influence our economy? One of the ways is that if the person is sick, the person can go to work. If the person cannot work, then the chances of poverty increases. You know, the person cannot afford proper medical health care. The person cannot afford good school for their children. I mean, and that's just like a generational thing going on. So it's important for us to understand that it's happening to us all. And supporting the movement against obstetric fistula, or supporting the movement for prevention of obstetric fistula is very important. It's very important. It's something that is totally avoidable. It doesn't have to happen. So if you are in any position to help prevent that, for instance, making sure that your girl stays in school instead of getting married, or providing, you know, proper medical health care for the people around you, or even your neighbor, you know, giving her a ride to the hospital when you can, contribute in any way you can. It's a movement for us all. And try and create awareness. Tell another person. Tell them it is not the mother's fault. It is not genetical. It is not about juju. It is what it is. It's obstetric fistula. And it's a condition that can be managed. And it can also be treated. More importantly, it can be prevented. Prevention, they say, is better than cure.
Right.
Yeah.
Mm-hmm. Well said. Wow. Thank you so much, Dr. Nafia. That was really, really, really enlightening. Good to have you, and we hope to see you again. Yeah. Thank you so much, Steph.